Hello everyone, I hope everybody's having a great summer. There are a couple topics that I wanted to touch base on. The majority of items or the information is actually going to be embedded in the documents along with this communication, but I did want to give a quick overview on both so that as you have questions or input on either topic, please reach out. The first one is related to the MUI-UI rule, the change as of July 1st. Now that everyone has had that training internally that has been asked to be completed by July 31st, I wanted to send out this communication to hopefully better explain how EI, our department 0 to 5, fits into that MUI-UI process. There are a lot of changes with what has to be reported on. And so I developed a list of questions and sent them to the MUI director to make sure that I understood and that we could communicate and guide each of you with all of the different scenarios that we deal with in EI. So I say all that to first state, we are EI providers, but we are not certified providers as it pertains to the MUI rule. That's actually certified providers means that you are billing Medicaid to provide waiver services, which we do neither. However, there is a component of being a mandated reporter, and there are certain items with the MUI updates that we still, as mandated reporters, need to report both to Children's Services and MUI. So first off, let me say, if in doubt, if there's ever a concern, it's not our duty to decide, it's our duty to report to Children's Services. Anything related to possible abuse or neglect, anything that you as a mandated reporter, as a professional working with children and families that you feel could negatively impact that child. Children's Services might not even take the referral, they might not follow through, they might even dismiss you when you call. That has happened. However, it is still your duty to report. Never let any piece of information that doesn't sit well with you stay with you. I promise you that leadership will 100% support you every single time in any situation that feels hard in those cases. We just want you to report. So that is Children's Services. Anything, any and all kids that we serve, that is our duty to report those as a mandated reporter. As those relate to MUI though, as you sift those out, there are in terms of reporting MUIs, they are now for our age group 0 to 5 non-waiver related services that are being provided are about alleged abuse or neglect. So when you're reporting alleged abuse or neglect to Children's Services, you would also report that to MUI. Please note that the new reporting MUI process is you have to report it verbally within 4 hours of knowledge of that information. And then you also need to quickly follow up with the incident report form to give the written report about the MUI that you're reporting as well. So abuse or neglect must be reported as an MUI in addition to calling that into Children's Services, and also in a case of a child passing away. So again, it's the change in categories as it relates to MUI really boiled down how many of the situations that we both contact Children's Services about and contact the MUI and make an MUI report about. So the vast majority of calls will go primarily to Children's Services, but if they're about abuse or neglect, we must report those as MUIs as well. So please take the time to read the information that I've attached to this email. It has the questions that I asked specifically of Bonnie to make sure that I was 100% clear about how all of that information filters into EI. I watched the video and I'm like, I always have questions. So those questions, please have access to the reporting how to report PDF that's attached to this email. Bonnie sent that, and it's really clear, like a step-by-step. If it's an MUI, you must first call and make a verbal report first, and then you have to follow up with an updated form that is now in circulation. It's attached to this email. It's now called an incident report. So do away with any MUI or UI forms previously prior to July 1. So stop using that one that has been in circulation for probably 15 years. It's now called an incident report form, and that's the one you would use to report both MUIs and incident reports. So I will now go over those issues that we would previously report as UIs. It was like the vast majority of our kids, we were usually reporting UIs. So the MUI process is the primary focus and spotlight of why I'm bringing this up, so that you know how to clearly report it and what you need to report in that situation. But internally, we have always reviewed previously called UIs. We would look for trends and patterns for families to see, where we might help or assist situations that families encounter. So that's 0 to 5. We have a lot of children that are in the preschool realm. We've seen elopements. We've seen a lot of things related to health and safety. So we're still asking you to fill those incident report forms out as you would UIs. I think this is really important and to help support families. But you would only send those to your direct supervisor or whoever you're reporting to at that time. If your supervisor is out, myself and the nurse professional on staff, Ellen Dively. So you're still doing that. You're just removing the UI email, and we are still going to continue to track those and look for patterns and anything that we could do that we might need to be aware of for select families. We have so many families enrolled that this is a way to just we feel like it's something that we need to continue. It's maybe not a best practice, but it's a good practice when we're working with so many families and you deal with so many unique situations. It's an effort to, try to help families, not to track or monitor what you're doing or not doing. It's really to sift those families out that seem to always have something come up, or, just some really challenging circumstances. So the incident report form, previously referred to as UIs, again, those would be emailed to the three of us. And if you can get those to us within 24 hours, or just be in contact with us, let us know what's happening, and the report is soon to come. In regards to the process, we still want you to always call, talk through any scenarios, any concerns that you have. When I say scenarios, I will say real issue scenarios, because working with children and families, your questions and your thoughts can go to all sorts of what if this, or what if that. Like we really do need to talk through real life situations to troubleshoot and maybe preempt some things for families. But so feel free to call and work through those. But again, swinging back to that mandated reporter piece, if you come to any of us, any leadership, and says, should I call Children's Services? If you're asking if you should get the consistent message that yes, you need to call. We're not the decision makers. We're not the ones to say yes or no, you should or you shouldn't. Our duty is to inform, and Children's Services is the agent that would decide whether or not something needs to follow up with that information. Okay, with that being said, just one more reminder about the forms. Please plug in the MUI number that you would call. Make sure you have that saved in your computer, or in your computer is fine, but I'm actually talking about your iPhone, somewhere you can get to it quickly. Also, the incident report form, make sure you have a copy of that handy at all times. I believe they put that in the Mariaki backpack, but I'm not 100% on that. So I've also included it to this email, so you can download it and keep it places that you can have it handy. And again, do away with any old forms that you might have. Okay, so switching gears on more templates for case notes. So we've had a lot of guidance or this DCY communication, Department of Children and Youth, has communicated that they're going to heavily be reviewing practices of evaluation and assessment, annual assessment processes, what we're doing, how we're doing it. I really appreciate all of you putting into place the communication of the exit cause ratings to the service coordinators. That was something that some staff have been doing, some haven't. So just to make a consistent process for everybody when it's clear, and we were told by DCY that we absolutely have to share that information at exit. I really appreciate you doing that and getting that in place so quickly. And Help Me Grow supervisors did reach out this week and say thank you. They noted it as a positive that the form that they're getting is being sent over consistently by staff, and it's exactly what they need to be able to close that child out of their system. So thank you for doing that. Going back to the guidance from the state, we have developed some templates of several different activities that you do in EI. So there's an annual I think there's an initial IFSP meeting, there's an initial EDE, initial SPA. I left out any case notes so far for annual assessments because there's some discussion locally about wanting to make some adjustments to that process since children are no longer having to redetermine their eligibility. So I didn't incorporate any of those into Gatekeeper yet. There probably will be. So the template should be in Gatekeeper to access that way. I've also included just the Word document of each of them that have been added into this email as well, so that if you want to copy and paste, and I know some people do, you decide to type on a Word document and then you copy and paste and put it in a case note later. And it's just a quick reference so you can see what's been added too. So there's also a case note for SSPs. I think that's been requested months ago, so I'm sorry about the delay on that. If you see any concerns, misspellings, I'll be the first to admit I read things, reread things, have people read things to detect errors and grammatical errors and spelling errors, and I'll finally get things in circulation and then someone finds an error. So if something needs to be adjusted, is wrong, is incorrect, please let us know. It's easy to fix it. And you don't have to go back and redo any case notes, but we're asking you to start putting these into your practices of documentation moving forward. So there's some language around evaluation and assessment that I think is important, and I think there's a lot of importance in relation to how you document your informed clinical opinion. You should be doing that very thoroughly in your write-up. That I think it's the EI, I'm probably going to get it wrong, EIO3, EIO4, whatever the evaluation and assessment report is that is embedded into the IFSP. You obviously have to be clear there about the informed clinical opinion and how you got there and how it impacts the child's development. And we also need to see that in the documentation and Gatekeeper as well. So as we add more, there's some that are probably like optional to use, but in terms of like those standardized, the case notes, the home instruction sheet that you guys are doing, I really appreciate you using that template, initial EDE, initial SPA, SSP, what was the other one? There's a transition one, and actually it's in relation to your last visit with families. So the exit visit is another one that we have put in there that we're asking you to use. So your last visit with the family, assuming it's scheduled, assuming that you know that the child is exiting, assuming they're turning 3, if you just want to take a look at the template, and it's in relation to discussing the cause and how you came to the cause ratings with the family, so that that discussion is documented there instead of on that form that you're sending to service coordinators. And there's one other line item that I asked that in terms of exit is transition at age 3. So that's the statement. And it's just about like, where is that child going? What is the plan for that child now that the child is exiting EI? So if the child is exiting for, because they're moving or they're not doing, they're no longer interested in EI, obviously you would put NA, or you could delete that statement completely. But if they are turning 3, transition at age 3, a child's eligible for preschool or a child's not eligible for preschool. So, enjoying time at the house with the family, or, staying in, continuing at the childcare that they're enrolled in, just something quick that kind of wraps up their time in EI and tells us what their next steps are. So with that, I will apologize for the long video. Please review the information that I've shared and incorporate them into your daily practices. Have a great weekend.